Thank you so much for coming and joining me tonight for this very exciting discussion. So we're going to unpack quite a bit of information about GLP-1 weight loss medications, which come by a lot of different names. And I will describe kind of some of the different terms you might see in the news or from medical care providers, so you have a better understanding of that. I'll kind of briefly go over some of the basics of what the medications are and what they're doing in our body. But I'm going to spend a little bit more time probably on some of the things that I feel you might have more questions on, as far as what are the pros and cons, what are the side effects, what's the management of, how do we manage the nutrition, the exercise, and all those different aspects that are surrounding the medication. As I mentioned in the email that I sent out today, and when you initially registered, please put any questions right into the chat box. I'm going to try to keep the webinar as short as possible so that we can have time for questions at the end and hopefully get to most of your questions if I can answer them. There might be some that I can't answer, but I will try my best to answer as much to my knowledge as possible. And if anything comes up, you just let me know. So we are going to go ahead and get started with our information. So first off, as we get going here, just a little introduction on me. For those of you who don't know me, my name is Samantha McCarthy. I'm a registered dietitian and I work at Cedardale Health and Fitness. I've been there for over 10 years now, and I am the director of nutrition and wellness and also our group exercise programming. And I've worked with clients with one-on-one counseling and group programs for, oh gosh, how long have I been a dietitian now? About 16, 17 years. And I've worked in the fitness industry for a little bit longer than that. I started when I was 18 teaching group exercise classes. So the fitness and health and wellness and nutrition industry is really very near and dear to my heart. And I'm very passionate about it. So I'm very excited to share all this information with you all. So that's just a little bit about me. So just a little disclaimer before we get started and head into our information. Just keep in mind, I'm not a doctor. I'm not a pharmacist. I'm a registered dietitian, so I cannot diagnose, and I certainly cannot give you exact information as far as your personal experience and your personal medical history until I'm able to assess you. So please just take all this information that we discuss as just educational purposes, and offline, in a one-on-one type of session, that's when we can talk a little bit more in detail when I know more about kind of your situation and what's going on there. All right, so let's start. I always love talking about statistics. It's just very exciting. So for those of you who are really not aware, our country's health is in dire need. We're headed down a pretty bad path. So just to throw out some basic statistics as far as obesity goes, between 2017 and 2020, 41% of US adults presented with obesity. That's by definition of BMI over 30. And BMI is a ratio between your height and your weight. Okay. This is an increase of almost a little over 10% actually, compared to the year 1999 to 2000. So it's a pretty drastic increase, and that's expected to go up even more. During this time, what we consider severe obesity increased from 4.7 to 9.2%. Severe obesity is a BMI over 40. Okay, so again, that's just that equation that you use between your height and your weight, which you can Google and figure out exactly what your BMI is if you don't know what that is. On the other side of that, talking more about some comorbidities and diseases, 58% of adults with obesity have hypertension, aka high blood pressure. So that's a pretty high percentage. 23% of adults with obesity have type 2 diabetes. In 2019, annual medical costs for adults with obesity was about $1,800 to $1,900 higher per person than adults with a healthy weight. So it's definitely much more expensive. And for adults with severe obesity, that BMI that's over 40, the excess costs were over $3,000 per person. Again, this is an average. This accounts for nearly $173 billion in medical expenditures in 2019 dollars. So it might be a little bit different now with inflation. So the point of that is in even more staggering is really by 2030, it's projected that 50% of US adults will have obesity and 1 in 4 are going to present with severe obesity. So those are the pretty big numbers. That's a lot of people walking around with excess fat on their bodies. And that's why a lot of these medications are being so heavily looked at and studied. In the medical world because it's definitely an issue. So, just a little history on anti-obesity medications. These are not new. There have been a lot of medications tested and taken off the market over the years. Some of the more popular ones that you might recognize, they started as early as 1933, but really probably the bigger one that might be familiar to you, depending on your age, is phentermine, which is actually still around. So both of these first two medications, the dinitrofenol and the phentermine, do come with a lot of side effects. And actually, phentermine is still on the market, but the first one that came out is no longer on the market just because the huge risk of death. So they've tested a lot of medications over the years, and really the side effects have shown to be a lot worse and just not worth what someone could tolerate or really could make their health worse. So phentermine was the big one that came out in 1959. There really wasn't anything else that came out until 1999, which is orlistat. And that one is an interesting one. It works much differently than some of the more recent medications like the semaglutide and the riraglutide that have come out. Orlistat actually works on the fat, but this one is very hard to tolerate. It's still available, but a lot of patients that take orlistat really can't tolerate it due to the side effects. The biggest one would be diarrhea and just digestive issues. So sometimes it's pretty severe in some people. So really, it hasn't been until more recent years that we have had these GLP-1 medications start to come out and be used pretty regularly. All right, so let's talk a little bit more about really what is GLP-1. You've heard that term thrown around. You've seen it maybe in the news or articles that you read, or maybe in talking with other people that are using it or healthcare providers. So basically what it is GLP-1 and GIP are a class of hormones that are part of the incretin family, okay? And these are hormones that live in your gut. So we don't think about these things, but after we eat a meal, there's a lot of things that are going on in our body. And that starts with some hormone releases that start to break down our food so that we can metabolize them and get them to where they need to go in the body. Okay. So what GLP-1 does is it helps to increase insulin release from the pancreas. This is pretty important after a meal because insulin, if you're not familiar with what that is, that's a hormone that helps to lower blood sugar in your bloodstream. So as you start to break down the food components of the meal that you ate, and those sugars start to head into your bloodstream to go throughout the body, insulin is going to come in and then grab those and start to lower your blood sugar so it can go back to that kind of normal baseline level. So that's pretty important, right? GLP-1 also inhibits glucagon secretion, and that's a hormone that tells us that we are hungry. So when the stomach is empty, glucagon is the hormone that gets released that tells your brain, hey, it's time to eat, and you start to feel those hunger signals, and you know it's time for a meal or a snack or something like that. It also binds with receptors in the hypothalamus to increase satiety. So it helps to tell our brains that, hey, you're full now, so we should stop eating. And then the other part of it is that it slows gastric motility, gastric emptying, and then appetite. So basically, stuff is sitting in your stomach a little bit longer, making you feel full for a longer period of time. Okay. Now, GIP also increases insulin release from the pancreas, and it also inhibits glucagon secretion. So they kind of work together. It's pretty scientific. I'm not going to go into all the details of that. But what research has told us and why these medications has really started to become used more often is that incretin hormones are altered in those that have type 2 diabetes and are overweight and obesity. So these are kind of where some of the science has stemmed from and how they kind of figured this out. Oh, I went the wrong way. Sorry. All right, so let's talk a little bit more about what some of the common medications are. So you might recognize some of these brand names like Trulicity. That's a common one that's used for diabetes. Victoza and Saxenda are used for weight loss, as well as diabetes in some cases. And then we have the semaglutides, which are the injectables. This is the Ozempic and the Wegovy that you're probably familiar with. Ozempic is the diabetes version of it. Wegovy is the weight loss related version of it. And then there are newer tablets, which are the Ribelsis tablets, which are a little bit not as readily available, not as highly prescribed as some of the injectables are. And then the newest ones to come out, really, I think they were approved last fall, are these dual GLP-1 and GIP receptor agonist medications. I know that's a lot of words, but they go by the names of Mounjaro and Zepbound, which you might have heard. And these are a lot more powerful than the Wegovy is. The weight loss is a lot bigger with these medications, but that also means that the side effects are often a little bit more accelerated when it comes to these medications. So that's kind of just a gloss over some of these common ones and the names that you might understand them. So let's talk a little bit more about the Wegovys and the Ozempics of the world, because that's what you hear all over the news. So how it works is if we go back to that previous slide and think about what does that GLP-1 actually do? Well, how this medication works is it's basically mimicking the GLP-1 hormone. So it's having all of those same effects that GLP-1 hormone has, which are to, decrease appetite, to help with insulin, to slow gastric emptying. So all of these things are great to help control your appetite and then eventually lead to that weight loss. So it increases that feelings of satiety, it decreases hunger, and it works very similarly to kind of the natural appetite hormones that are working in your body so that you really end up eating fewer calories and lose weight. The typical results with these medications that we've seen, the most recent studies show a 6.2 to 12.4% loss of body weight compared to placebo studies. So that's a pretty significant drop in weight, and they're usually over the course of the year. Most of the studies look at. So that's pretty big for a lot of people. But it certainly does come with side effects. Okay, so some of the common side effects are definitely the digestive issues. So this could be nausea or vomiting, nausea being more common of those. Diarrhea and constipation, it can go back and forth between those two. Abdominal pain, or kind of like maybe some gassiness, or maybe a little bit of like just discomfort in the abdomen area. Headache can be a side effect. Fatigue, indigestion, because foods are sitting in your stomach a lot longer. Having that kind of acid reflux type of feeling or heartburn type of feeling is fairly common, especially if you overeat or eat meals that are very high in fat when you're on this medication. Dizziness could occur. Hypoglycemia can also occur, especially if you're type 2 diabetic, because remember that GLP-1 hormone is also working to lower your blood sugar. So of course that puts you at risk for that hypoglycemia, which is a fancy word for low blood sugar, where you might feel that shakiness, that low energy, that dizziness. So certainly something to keep an eye on if you're currently on the medication or thinking about it. Flatulence, so gas, and then GERD. So those are the very common. The digestive ones are the most common, and they typically occur when you have the injection. So if you have your injection, let's say you do that on Sunday morning, you're probably going to feel a lot of those side effects, definitely Sunday and maybe into Monday, maybe into Tuesday, but it usually starts to subside as you go through the week. And then by the time you get to Sunday, again, where you do your next weekly injection, you might be feeling fairly good at that point. And then you have your injection again. You might have some more side effects, but you also, most people do report like getting used to some of those side effects, or they start to minimize as they progress along with the medication. Now, what you usually do with the medication with your doctor is we do what we call titrate up. So you start at a lower dosage of the medication and then slowly add or increase that dosage. And that's totally dependent on you. One thing I always tell my clients or patients that are on the medication, or anyone who asks, is there is that highest dosage, the 2.4 milligrams, but that doesn't mean that you have to get up to that highest dosage. Okay. You might be tolerating everything well and losing weight and having minimal side effects at a much lower dosage. And that's okay. As long as you have that conversation with your doctor to say, hey, I'm doing okay at this dosage. I think I want to stay here. I would definitely recommend that because those higher dosages usually lead to bigger side effects at the higher dosage. So it really depends on you. Some people tolerate it much better than others. Okay. Okay, so a little bit more about the semaglutide medications. So contraindications, so reasons for really not taking this medication where you shouldn't, even consider it would be personal or family history of medullary thyroid cancer, a history of pancreatitis, and if you're pregnant, definitely something to talk to your doctor about. Other safety concerns from actual use of the medication would be thyroid C-cell tumors. That was observed in rodents, not humans. So something to be considered of. Also acute pancreatitis, because remember the GLP-1 is helping, and it's linked to the insulin in the pancreas. So there are things going on in your gut and in your metabolic system that might affect the pancreas. You also have risk of gallbladder disease or even gallstones. That can come with not necessarily just the medication, but also just very fast weight loss. Hypoglycemia, as we talked about before, that very low blood sugar. Tachycardia, which is increased heart rate, that can occur as well. Renal impairment, which is kidney impairment, and then suicidal behavior. We'll talk a little bit about the mental health side of things in a few slides, but that's definitely something to have an eye on for anybody that is taking the medication that you know of, family, friends, or even yourself. And all of this is stuff that's available on the label of the medication, and a lot of other things. So things that you could read as you progress along with the medication. So that's some of the basics of the medication. Before we dive into more of the nutrition, exercise, and lifestyle, I just want to talk a little bit about the compounded meds and some of the other versions of the semaglutides that are out there. With this drug kind of being like a magic pill or magic injections, it's more so the injection than the actual pill that gets prescribed. There's a lot of different versions, so different businesses online, even just storefronts and other healthcare businesses or kind of health and wellness businesses that are creating different versions of this medication that aren't the same version that come from an actual pharmacy. So you want to be very careful about these, of getting them from anywhere that isn't an actual pharmacy that's state licensed, because there can be a number of different things that end up in the medication that might not be safe. They might not be tested, and they might create even worse side effects than the actual medication does. These are not reviewed or approved by the FDA. They only do the actual prescription version of the medications. And they can often have different active ingredients. And these active ingredients have not been shown in research to be as effective as the actual prescription versions of the medications. So they often use what we call a salt form of semaglutide, which has not been shown to have the same weight loss impacts. And it also has not been shown to be safe either. So really try to avoid these at all costs, and really just go to your doctor to get that prescription and make sure that prescription is coming from a state licensed pharmacy, and that it's also within the US, because there's also a lot of online businesses that are coming from outside of the US. And of course, that's not being regulated by our FDA by any means. So you want to be very cognizant of that when you're choosing the medication. All right, so let's dive into the pros and cons a little bit. So we'll switch gears. We know some of the side effects, so the ones that have been observed in research and what that actually means. But let's talk a little bit more about kind of my view and what I've seen in research for some of the pros and cons of the medication. So we'll start with some of the cons, which are on the left side of the screen. So of course, we know the digestive side effects are a big issue, and what you can tolerate is going to be dependent on the person and how severe the side effects can be. So nausea, vomiting, burping, constipation, diarrhea, these can be annoying, and certainly can cause some health concerns. There are things you can do nutritionally to manage the side effects, but it is a pretty negative for a lot of people. And some people really just end up vomiting a lot or just really can't tolerate the constant trips to the bathroom. So something to consider if you are thinking about the medication. And a big one that is really a concern, especially in my world, is the accelerated muscle loss or wasting. And this comes with any form of losing weight very fast. When you lose weight at a very accelerated rate, you're going to lose a lot of muscle mass, especially if you're not exercising and you're not eating adequately to maintain that muscle loss. Our bodies will pull from our muscle first before they pull for fat if you're not having the right balance of exercise and nutrition. So this can be a big concern because we don't want to lose a lot of muscle mass because then you might start to lose your ability to perform your activities of daily living, especially if you're a little bit older and more seniors taking this medication, where we're already concerned about muscle loss and their ability to do just regular activities like showering and cooking and getting around and walking and going up and down the stairs. This can certainly be a concern because it's very hard also to get that muscle back as we start to get older and older. So this is something to really pay attention to and to know if you're thinking about the medication or if you're on the medication. Because if you're not exercising, you're going to lose a lot of muscle. So that's one of the big things that has been shown in research to be something that really should be pushed for anybody that is going on these medications to make sure you exercise and to get that strength training in. Along with that, there could be bone health implications because if you're losing a lot of muscle mass and you're not moving and you're not eating adequate nutrition, you're not getting nutrients that you need, like calcium and vitamin D, there could be implications in your bone health. So you might be, losing out on some bone mass if you're on if you have that quick weight loss, if you're extending that low calorie intake and not getting that exercise, that's going to be an issue, especially for women. And if you're already at risk for osteoporosis or even have osteopenia currently. There's potential vitamin and mineral deficiencies, again, because you might not be eating enough. We'll talk about those in a couple slides and what vitamins are going to be more of a concern. Dehydration. This is one that I hear a lot from my clients is that dehydration or really just not drinking a lot of water is a big concern because if you're one thing they talk about is you lose your appetite, of course, but you also lose your desire or even just like that thought process of having any water at all. So it's not uncommon that I listen to people say that, oh man, I didn't even have like any water throughout the day. It's hard enough for them to eat. So to drink the water is another issue. There's also, we talked about before, the risk of gallbladder issues and gallbladder stones, and that comes with any accelerated weight loss that is very fast in a short amount of time. Mental health changes. We'll dive a little bit more into that in one of our last slides, but this is something that I've seen positives and negatives on this, and it's more linked really to what food means to you and whether it's a coping mechanism for you or not. And what that means is going to be very specific to the person and what their current mental health is and how much their weight affects that mental health. So that's something to really think about moving forward. The reason for that is what I often see happen, and I said whether people are on medication or not, is food is very emotional for many people. Whether it's stress management, it's something they celebrate with, so it's a more positive way to eat. It's boredom, it's coping for sadness or depression or anxiety. You see that a lot as well. And if suddenly you take that away because food really loses its appeal, and you really don't eat a lot when you're on these medications, you take that away, you might be missing something. Because if food was a really big part of your life and now you don't have that food to cope when you're under stress or emotions or whatever it is, that can be an issue, and it can affect you in a mental health. But like I said before, it can also go the positive way. So if you're feeling really maybe depressed or anxious or down on yourself because of your weight, because you can't move, because you're feeling that constant guilt about what you're eating and what your health is currently like, then of course losing weight and improving your health can also improve your mental health as well. So it can go both ways. Again, it's dependent on the person. We talked about acute pancreatitis as one of the major cons before. Hypoglycemia, dizziness, that increased heart rate. And that increased heart rate is, if you have heart health issues already, that's something to make sure that your doctor is looking at as well. Renal impairment, so kidney issues, and that can be due to a number of different issues of just nutritional imbalances, losing weight too fast, and just the medication itself. And then the last two, the cost and availability is definitely a big one. That's a huge con for our whole country. Of course, the availability issue, I'm sure you've heard about. Pharmacies have a tough time getting certain medications. So it's not unlikely that you might go a week without the medication, maybe longer. You might have to change dosage. There could be a time that you don't have it. So then if you're relying on that, that can certainly change things around a little bit. And then also the cost. Right now, it's extremely expensive for this medication. If you have good health insurance, then you're lucky, and they're covering a lot of the cost of it. But for a lot of the country, Medicare doesn't cover it right now. Medicaid does not cover it right now, and that's a big chunk of our population in America. So that cost is huge, and certainly not a cost that a lot of people that are on fixed income can afford. So that's a big one. And then food aversions. And that's something I hear very often from a lot of my clients, that foods suddenly become either gross, really unappealing, you can't get near it, you can't smell it. For any moms on here, it's been compared to like when you're pregnant and you might have those food aversions during pregnancy. That's a big one. So again, that kind of goes with kind of expecting that change in your eating and your appetite and what that might mean for your mental health and for your lifestyle. But that's a big one I see that can be somewhat sad for a lot of people. A food that they used to love and enjoy quite a bit is suddenly not something that they're interested in whatsoever. So those are definitely the negatives of the medication, and there's probably more that I'm missing, but those are the big ones that I have seen in research and also seen personally in my actual practice with my clients. Now, the pros of the medication, of course, a lot of these are related to improving your health. Okay. A lot of these issues like blood pressure and cholesterol are related to weight and poor unhealthy lifestyle. So, losing weight and starting to eat a little bit healthier, change your lifestyle a little bit is going to improve a lot of these things, right? So a decrease in blood pressure is seen across the board in almost everybody that's taking the medication and that can tolerate it. Decreased LDL, which is your bad cholesterol. An increased HDL, which is your good cholesterol. Decreased triglycerides. That's kind of a fancy word for fat, but something that is measured on your lipid panel when your doctor takes your blood. Decreased A1C, of course, this drug was, the semaglutide at least was originally used for diabetes. So of course it's going to decrease A1C for those of you that do have diabetes. And then other potential benefits, like across the board, obviously we're going to improve obesity rates, diabetes rates. And then there's a lot of research now going on around cardiovascular disease and the decreased risk of heart issues for people that are on these medications that might be independent from losing weight. So that's a new area. There has been some new studies or news articles that have come out with the heart benefits. And they're starting to prescribe medications for people that have cardiovascular disease that can really significantly help. They're also starting to show some improvements in kidney disease and also non-alcoholic fatty liver disease. So it's not just obesity that we're talking about with the pros of the medication. There are other areas as well that they're starting to see research come out. All right, so that's a little bit of some of the basic pros and cons. So to talk a little bit more about long-term use of the medication now. In the medical worlds, obesity is considered and not it's a little bit of a hot topic, but obesity is starting to be considered by a lot of providers as a chronic disease. And chronic diseases, so let's say high blood pressure, high cholesterol, diabetes, how are those treated? Well, they're treated with long-term medication use. So really that's what researchers in the medical world is starting to see the semaglutide medications as being, as a long-term use to treat this chronic disease of obesity. There's not a lot of data yet on long-term use. We have studies 3 to 5 years. That's the longest term we have right now, which is long. But we don't know, if somebody's on this medication for 10, 20, 30 years, what that might mean. If you're putting somebody in their 20s on this medication and they do use it for the rest of their life, what are the implications for the body? We just don't have that data yet, and that's something to consider if you are considering that medication. And how many more years of your life might you have and be on this medication? So if you aren't considering long-term use, one thing to also think about is that every study that has been done thus far as to what happens when people stop the medication, they all show across the board that weight gain reoccurs after you stop the medication. And sometimes that can be pretty fast as well. So very similar to maybe if you've done a lot of diets throughout your life where, you restrict, 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 and don't eat, and you're following this diet perfectly, and then you fall off, so to speak. And what happens? You start going back to your old habits and you put the weight back on. It can be a very similar process. So we really just don't know what long-term use will look like in the medical world surrounding these medications and their use for weight loss. Okay, so let's talk more specifically about lifestyle and nutrition considerations, whether you're thinking about going on these medications or you're currently on them. What should you really be paying attention to? So starting off with nutrition, of course, my area of expertise. So key issues with the nutrition side of things is how do we manage the digestive issues that typically occur? So the nausea, the diarrhea, the vomiting, anything else like the GERD that might occur, all those things. So one thing you want to think about is small, frequent meals, because the appetite, as I mentioned before, is really not there. And depending on your dosage and how you're responding to the medication, sometimes it's really just you have no appetite whatsoever and no desire to eat. Whereas some people might have times where they are hungry, or maybe, 5 to 6 days into their weekly dosage, they're starting to feel that appetite a little more. Whereas maybe the first couple days after their injection, they really don't have a lot of appetite, but it starts to come back as the week goes on. So that's a difficult one. So those small, frequent meals can be a lot better and better tolerated compared to maybe 1, 2, or 3 large meals in order to get all of that nutrition in. Shakes, smoothies, bars, things that have a lot of protein in them, like bone broth, which is something you could just sip. All these things can be better tolerated if you are on the medication because they're quick, they're easy to eat, they're well digested by our bodies, and those can be a little bit more tolerated than, say, a large salad with some chicken on top of it, or a gigantic piece of fish with some broccoli on the side. That's a lot for our bodies to break down, and that food is already sitting in your stomach for an extended period of time, so you can cause more of those digestive issues. Maintaining adequate fluids, like I mentioned before, that desire and even thought to drink water throughout the day is really not there because it goes along with the decrease in appetite. And if you suffer from constipation because of the medication, that's going to be a recipe for disaster, because if you're not drinking, you have the side effect of the constipation, it's really just going to make it worse. And that can be a concern. So getting adequate fiber is something that is really important. along with the protein, which we'll talk about in a moment. And this can be tough. 24 grams of fiber for women and 38 grams for men. That's pretty high. You know, if you don't have, it's hard enough to get that with a regular appetite. Without an appetite, it's a bit of a challenge. But that is what our bodies need to work at their most optimal level. And then if you are experiencing a lot of the nausea that might come with the medication, use of like maybe ginger teas, peppermint teas, kind of sprinkling those throughout the day or into your foods, can really help to manage some of the nausea that you might experience in the first day or two, and hopefully only the first day or two. Um, all right, so protein. We talked about that accelerated muscle loss and wasting a few moments ago. And protein is number one as far as nutrition goes, and getting that protein in to help you maintain that muscle mass and not lose muscle, because we all want to lose the fat, right? That's our ideal goal, is lose the body fat so we can move and feel better. But if you don't eat enough, you're going to lose that muscle mass. So getting that adequate protein will help you to maintain that muscle mass. But again, it's hard. If you don't have that appetite, it's going to be very difficult, and it's often forcing yourself to eat in order to get all of those nutrients in, so you don't end up with nutrient deficiencies that are going to affect your body in some way, shape, or form. So the ideal amount of protein, typically we recommend 1.2 to 1.5 grams per kilogram of your ideal body weight, not your current body weight, but the ideal body weight. That can fluctuate a little bit depending on your medical history, especially if you have diabetes or kidney issues. That might be a little bit lower. You might need a little bit higher. So something that we would talk about individually if we need to. But that's really where it should be. And I often see people well below that as far as protein goes, because they just really don't have the desire to eat. And that's where those protein shakes, the protein smoothies, the protein bars, and things like bone broth can be really helpful, because they are great sources of protein. So that helps get those nutrients in. Now, the vitamins and minerals that we're really concerned about and what can cause an issue in the body if you're not eating enough are listed at the bottom of this slide. So you'll see iron is a big one, especially if you're still a female and you're still menstruating. Iron is a real concern because if you're not eating enough foods, you're probably deficient in iron. And then, of course, that can cause a lot of issues such as anemia. Folate, B12, and then B1. So some of your B vitamins that are present in a lot of our foods are often very deficient if you're not eating enough. Zinc is another one, and that's really important for immunity. And a lot of these things come from your protein-based foods. So again, adding more protein in is going to help you get a lot of these nutrients. Copper is another one that can be low in people that take these medications. And then going along with the bone health, the vitamin D and the calcium are often very low as well. And that's going to negatively impact the bone health in addition to the loss of the muscle mass and just not moving and not exercising. So if you're really struggling to get the food in because your appetite is just not there, then supplementation might be necessary to make sure you don't become deficient in these nutrients, because these are really essential nutrients for our body that have important purposes. Okay. So talking a little bit more about physical activity now. So as far as aerobic activity to work the heart, it's recommended to get over 150 minutes per week of moderate intensity exercise. Moderate intensity exercise, that could really just be defined by exercise where you're starting to breathe heavy, you're maybe breaking a little bit of a sweat, but you're not killing yourself. It's not really vigorous where you could barely hold a conversation. At moderate intensity exercise, you could hold a conversation. It'd be a little bit challenged. You'd be breathing through that and taking those deep breaths, but you could do it if you had to. That's really where moderate intensity exercise would fall. And you want to get over 150 minutes per week. If you're not eating a lot and you're not getting that nutrition in, you're going to feel, and this is going to be very tough to get in because you don't have the nutrients to support that. But we know that exercise is really important to keep our heart healthy and keep our heart strong. So this is an important aspect of being on the medication. More importantly, the strength training. Okay. So, we know we should walk more, you should get that heart rate up, do that cardio, go on the bike, whatever it is. But the strength training is super, super important in order to maintain that muscle mass. Because if you're not eating enough, okay, you're not getting enough calories in because the appetite's not there, and you're doing a lot of aerobic, moderate intensity exercise, that's also a lot of calories burned. You're going to lose more muscle because your body is just not going to have those nutrients in to maintain that calorie burn and to maintain that muscle mass. So the muscle is going to be the first thing to go. So making sure that you get that strength training in and eating enough to support the strength training that you do is something that has to be considered and has to be incorporated to just stay as healthy as possible when you're on this medication. And then the lifestyle, other things, not necessarily nutrition or exercise related, are, the other pillars of wellness: sleep, stress management, managing that mental health. I mentioned before that something that doesn't often get talked about when it comes to these medications is really, what does that food mean to you, and how do you use it currently in your life? If you're really struggling with emotional eating and you're struggling with anxiety, depression, you use food to cope. You use it to celebrate. You use it in times of holidays and even times when you're down. You have to go into this knowing that, okay, I need a new coping strategy. I need something else to help me manage all of this. And if you don't, you're going to struggle a little bit. So that, maybe you need to work with a therapist. You really need to keep an eye on that mental health as you go through this process, because things will change. It's a big lifestyle change. If your life is centered around going out to eat and social events and cooking and doing all of this, and suddenly you take that away, what's taking the place? So something really to think about. And if you are struggling more with that emotional eating, then that's probably when you should talk more with a provider, a licensed provider, a registered dietitian, a therapist, so that you can cope with that. Also maintaining sleep. Now, losing weight might help you with your sleep, especially if you suffer with sleep apnea and maybe use a CPAP machine. Weight loss can definitely help that. But making sure you're also getting that sleep and that rest so your body can recover, and managing stress in a healthy way and in a different way that isn't necessarily food related. So these are just some basic lifestyle things that you want to consider when you are thinking about this medication and or on the medication currently. Okay. So I've given you some information to kind of make a decision as to what you need to do if you're thinking about taking this medication, or maybe what you need to share with friends or family, if that's why you're here. And if you're on the medication, using some of the things that we just talked about in these last few slides to make sure you're getting as healthy as possible. But I always recommend, when you're on these medications, you really should get help from a registered dietitian and a personal trainer to help you with the exercise side if you need it. And then, of course, on the nutrition side of getting that, just making sure that you're getting all the nutrients that you're in, especially if you're not a dietitian, you don't have that nutrition degree, then you might not know exactly all those vitamins. Where do they lie? Where can you get them? Are you eating enough? And that we can certainly help you with. So just make sure you ask for help if you need it. At Cedardale, we have lots of different programs to help you from, of course, the fitness side, but also the nutrition side. So we have our two programs, one-on-one nutrition counseling, and also our group weight loss program, which can support you whether you're on the medication or whether you want an alternative method to medication to help you. So I can help answer any questions with those if you have any questions. But now I'm going to go ahead and just open up for some questions, because I'm sure you have some. So let me take a look at the chat form. Oh, look at that. I was aiming for 45 minutes and 45 minutes on the dot. I'm very impressed with myself. All right, but let me read through some of these chats and feel free to add some questions in if you have any. So, is the pill form of the weight loss medications the same as the shot? Technically, yes, it's the same. It's not as prescribed, as heavily prescribed, and it's typically always a different dosage because you're not injecting it. You're taking it by mouth. I don't know the exact dosages, but it is just as effective as the injectables are to have the pill form. Seen ads for pills on that say they mimic GLP ones for less cost. Scam? Not necessarily a scam. Hold on one second. My computer is about to die, even though it should be plugged in. Let's try that. All right, so I think we're up and running now. Okay, sorry about that. So yeah, those ads that you see on Instagram, Facebook, or whatever, that's part of that compounded medication that I talked about on one of the slides here, that you want to be really careful of. Yes, it might be cheaper than the prescription version, but there's a reason it's cheaper. So be very careful about that. And could it be a full scam and you might not actually get the medication? Maybe, but it's just kind of like supplements. You don't know what's going into those because they're not regulated. So there could be some things that are pretty dangerous in those medications. Um, have the side effects in our body changes been observed to continue long after stopping these medications? If you're stopping the medication, the side effects will go away. And like I said, it can be fairly quick because even with if you're doing the injectable with that weekly dose, those side effects start to wean as the week goes on. So it can, the immediate side effects of the digestive issues can certainly go away fairly quickly. Other things that might be going on in the body, the gallbladder issues or maybe pancreas issues or kidney issues, those could certainly be a little bit more long term, and we just don't know a lot of that yet. Oh yeah, so lack of ability is very common. Yes, to answer that question. So effective strategies for gaining access to the medication. If anybody has answers to that, I don't have the answers to that since I personally have not had to search for the medication. But things that I've been told by other providers and in my education is that you might need to look outside of certain areas. So certain areas might have shortages of this medication where other areas may not. So with your provider or even with your pharmacy, if they have multiple locations, trying to look around and you might have to go for a drive to get it. That I have heard has worked. But yeah, it's a big issue. And it's a real negative because they have quite a patent on these medications right now, the prescriptions, but they can only produce so much. And like I said, it is effective. So there's a lot of people going on the medication, which is concerning because probably not everybody needs to go on it. And we also need this medication for people that have diabetes that really need it. And they're experiencing shortages as well. All right. So what other questions? Did I miss any? Any other questions? I think I got all those from the chat. Okay. All right, awesome. So if you have any questions, please feel free to reach out to me. My contact information is on the screen right there. So you can give me a call, shoot me an email. I'm happy to help you with any help you may need as to whether you're deciding about medication use or whether you're currently on it and you need some nutritional help. Just let me know. Oftentimes insurance covers my services, so you don't have to pay anything. So you just feel free to reach out and we'll go from there. But I appreciate all spending your Wednesday night with me. I hope you have a good, healthy dinner after this or maybe before this. And I'll also send out the recording to everybody too once it's downloaded and ready to go. Thank you, everybody.